And hello, everyone. I hope you're doing well. Did we survive the snowstorm? As I'm recording this now, it's the day before it's supposed to hit. And so that's really kind of thrown off things a little bit within the physical therapy world. We are supposed to do in person interviews for our potential incoming students for next year. We had to switch to Zoom. So that's been kind of a unique experience doing it in that capacity. Well, I hope you're doing well. Let's talk about this week how to search the medical literature. And for some of you, this may be something very familiar, something very comfortable to do. For others, it may be something a little bit more challenging. So I want to try to show you some tips to kind of help you search things out and find your information as easy as possible. So last week we talked about the PICO, and of course, with the PICO, we want to try to make it as precise as possible or as descriptive as possible because that's going to help with your search. And some of you will have noticed that in your week 2 forums, I posed some questions because maybe your topic was general. Maybe that's on purpose. Maybe that's on purpose because that's kind of the current state of things. And if that's the case, perfect. Sometimes, though, you want to get more specific because if you don't get more specific, you may be overwhelmed with the volume of material that is available for you. So, what is your question? Again, that question is going to serve as the foundation for locating relevant references for your review. When asking a question about intervention, you need to delineate what's the treatment. So, what is your I? What's your intervention? On top of that, what is your comparison? Is it a control or is it kind of the current standard of practice? What's your O? What are those outcome measure or measures that you're interested in? And finally, what is your population characteristics? Is it something that is general or do you need to be specific, looking at a particular gender, a particular age range, a particular race or ethnic group? Here's a rehab example. Again, a PICO, something that I might be interested in as a physical therapist. So as a clinician, I work with patients with acute low back pain. I would like to know the effectiveness of spine manipulation for the lumbar spine and compare that to other conservative treatments or natural history. So for my population, I have selected adults 18 and older with low back pain. And I've provided a time frame, 16 days or less. So I'm curious about people that are in the subacute stage of healing. I didn't put acute because sometimes people, when they're in that initial 1 to 3, 1 to 6 day time period, it's too difficult. The spasming's too strong. They're too painful. It is difficult to do spine manipulation. And I also noted with no radicular symptoms beyond the knee. So I've made it very specific. My intervention is spine manipulation. My comparison is other physical therapy treatments or natural history, so I'm accepting any of those as I go through the literature. And for my outcomes, I'm looking at pain reduction, so using something like a visual analog scale. Here's a generic medical example. I have a patient with diagnosis X, and I want to know if medication A is appropriate at reducing the severity of symptoms. Currently, medication B is used for patients with this diagnosis. So for my PICO population, I want to define the population with diagnosis X. Do I do it by biologic sex? Or do I do it by gender? Do I do it by an age range? Or do I choose other demographics? Intervention medication A, comparison medication B, and then for the outcome severity of symptoms, however that is measured, whether that is a pen and paper tool, a visual analog scale, maybe how long it takes to recover from the diagnosis. Your PICO helps to inform your search. The keywords that you use may potentially all be included in your search. However, it is also possible that you focus on the P and I and maybe the O, and you review the titles and abstracts for the C. So what do I mean by that? We're going to be looking at keywords here in just a moment. Keywords are what we're going to be using to do our search. Sometimes, if you put everything related to your PICO into your search, you may have difficulty getting things. So maybe focus on, like I said here, the P and the I first, maybe the O, and then you can start reviewing through the titles and abstracts to see if they also included your C. Here's a rehab example, something that I published many years ago. And basically what I wanted to know was if one approach to exercise prescription for individuals with low back pain was superior at reducing pain and disability than the other approach. So my P would have been individuals with low back pain. Intervention would have been the general exercise approach. The comparison would have been the motor control exercise approach. And then the outcome would have been looking at reductions in pain and or disability. And going back to this here, ideally, it would be great if there were randomized controlled trials available that would specifically have compared motor control versus general exercise. However, sometimes there isn't. So as I did my search, I would search for both papers that looked at the intervention of global exercise or the general exercise approach, and also I looked at studies that looked for the motor control approach. Sometimes the comparisons were things like natural history, were things like other physical therapy modalities or medication. And so the point is, this was a systematic review I did, and it was difficult to come up with a clear recommendation. But hopefully what I'm illustrating is as you get into doing your literature review, you may face some of those challenges because there will be potentially gaps in the literature. But now, getting back to my earlier example, if I wanted to know that effectiveness of manipulation for low back pain, what would be keywords potentially to answer this question? Or what keywords could I use to help search for literature that could help answer this question? Those could be like manipulation, spine manipulation, low back pain, lumbar, HVLAT, which is our abbreviation for high velocity, low amplitude thrust. As a physical therapist, I know a lot of these terms. You, as soon-to-be physician assistants, will know a lot of terms related to the things that are of interest to you. Those are going to be your keywords. So, do you know your keywords? As I mentioned in the prior slide, knowledge of your topic will help you. You may know them just because you've been involved in studying your field, studying things of interest, and along those lines, you will have gained kind of some knowledge already about potential keywords. The other thing to do is look at keywords listed on studies that you're familiar with, and they're all usually published on the first page of a paper in the abstract region. So for example, for this particular study here, you can see that there's around 6 keywords that they included. These are designed to help people find their article. Here's one. And what I did is I just put in physician assistants into CINAHL. And this was one of the first ones that came up. And then you can see some keywords there. So you're going to start performing a search, and I'm going to illustrate some examples here in a bit. Sometimes, as you put keywords in, you can get an overwhelming number of citations. You don't have the time to go through all of them. So you've got to come up with a strategy to find a small number that could potentially get everything you want and not miss some key things. So let's say I was interested in looking at massage. So if I just typed in massage, over 15,000 results came up in PubMed. Nobody has the time to go through that number of results. Probably a lot of them aren't even related to massage. Somehow they just kind of get caught up in there. There are times that you'll go, how did that article get tied in with that particular keyword? A rule of thumb, and this is just a rule of thumb that I've learned over the years, that 300 abstracts is a good cutoff range. You may even want to have less than that. Maybe your particular topic, there is not a lot of research on it. Maybe you want to only look at 200 or even 100. But 300 is generally a good cutoff for a topic that has a lot of active research going on. So I do a search next, the massage and low back pain. 380 results came up. So that is pretty high. I might want to refine that or evolve that. The next one, massage and return to sport, only 13 results. I really like that. Now, again, I did not talk to you about a PICO. I did not throw out a question why I was interested in massage. All I'm trying to illustrate here is the importance of coming up with different keywords or keyword combinations to help refine your search, so that way you're not having to search through 15,000 articles. Instead, you're looking at 300 or fewer. So here's an example of a search strategy from that paper that I published looking at low back pain and different exercise approaches. So on one side are the keywords I used and the number of articles that were identified. And then as you can see, there were potentially relevant articles, but I did not look through the findings associated with just motor control exercise or the findings associated with therapeutic exercise and low back pain. Those were just overwhelming. But when I got down to things like general exercise and low back pain, that became more manageable. And I threw out a bunch of other examples, things that could potentially work. And that's what helped me narrow down my total number of articles that I used. And I think around 15 or so is what I finally settled on. You're going to be doing something like this for your homework this week. And we'll see this in again at the end in the last slide. But you're going to create a table. Actually, I've already uploaded a Word document and identified the tables, or excuse me, the columns. You're going to have a keyword column, identified article column, and a potentially relevant article column. And you're just going to practice doing keyword or keyword combinations and seeing how many articles come up and what were the potentially relevant articles from your reviewing of the titles and abstracts. So a component of your PICO assignment, if you had a chance, take a look at those PICO assignments that have been turned in by students in the past. You're going to have a results of search section. And within any systematic review or literature review, there's going to be a section like this. And what that section does is it illustrates to the reader how you went about the process of finding articles for your review paper. And so from a different systematic review that I published, here was the selection of articles section, and I referred the reader to table 1 so they could see the different keyword combinations or medical subject headings that I used. Here's a snippet from one of your former classmates, their results of search. And so you can see they used the term acute coronary syndrome, aspirin. This search yielded 2,980 articles. The dates were adjusted to display articles from 2008 to 2022, and 2,312 articles populated. After scrolling through the first few pages, blah, 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 you can see that they were basically dealing with a lot of articles. And what this individual then did is used different keywords or different medical terms to see if they could find appropriate articles. Now, you can include a table in your major assignment 1, your PICO paper, if you like. I have no problems with that. It's not required though. So if you just wanted to do a narrative writing of things, that's fine. But if you wanted to include this, I think that's perfectly acceptable for this paper. Okay, so conducting a search of the literature, one recommended strategy, this comes from a biomedical research text, look for articles that are, again, directly related to major focus of your project. That's kind of a no-duh. Through this process, you review the titles and the abstracts before downloading those articles. Establish a list of criteria for selecting articles, the database's search, the keywords or key terms used, and the dates of the review. That's kind of like what I've suggested here. Kind of keep a running table, and when you are going through things, for example, you might do something like look at patellofemoral dysfunction, and you deem that as potentially relevant, but you may also see those same articles pop up under patellofemoral pain and hip strength. And so what you see there is I found 15 articles, but 13 were included in the critical appraisal. It's possible that there were repeats there. Does that make sense? So, whoops, sorry about that. Let me get back into, by keeping track of what articles you're interested in, it just helps you avoid that duplication of downloading. Now, for selection of articles, rule of thumb, review literature that's 5 years old or newer, and of course, classic studies. A lot can happen in a 5-year time period. Sometimes going back 10 years may be appropriate if it is a rare condition that you're working with. And of course, classic studies are always important to include because a lot of times those may serve as the inspiration to other studies that come after it. Again, review those abstracts and then organize them into categories, those that are potentially relevant, and then articles to include in your literature review. Okay, so we're going to look at a couple different ways of searching the literature. And the first way here is to be able to access CINAHL and Medline together at the same time. And then we'll also look at PubMed, which is a platform to access Medline. The reason I'm going into the George Fox Library first is because the George Fox Library is going to have articles immediately available to you. But I want to highlight that sometimes I will get different results if I do things through the George Fox Library versus if I do things through PubMed. So go into the George Fox Library. You want to click on databases A through Z. And then you're going to get this screen, click on C, take it down to Cinol with full text, click on that. Brings you to this screen. Next, you're going to want to click on Choose Databases. That's there at the top in the middle. And a listing of different search engines will pop up. You'll want to scroll down. Cinol with full text should already have a check mark in it. Go ahead and check Medline. I think if you check Medline in Cinol with full text, that's going to cover just about everything you need. That's got a pretty good coverage for all the medical journals. You'll scroll back to the top and you're going to click OK in the area below Choose Databases. Now, if your topic involves something like sports, you may want to consider adding in Sport Discus with full text. If your future topic involves something mental health related or psychology, consider adding the psychology and behavioral health sciences. So, as a physical therapist, I might be interested in rehab programs for patients with primary or idiopathic adhesive capsulitis. I should have had that in there as an or versus just primary idiopathic. I know from clinical experience that physical therapists will often use exercise and manual therapy techniques. I'm curious what works best. So if I go in and I set up things by doing the Cinol with full text and the Medline, if I put in primary idiopathic adhesive capsulitis, 14 results. Now, after I did this, maybe I should have just put primary adhesive capsulitis, or maybe I should have put idiopathic adhesive capsulitis, but I only got 14 results, so that's not very many. So maybe that's an indication that I didn't do a very good search. Probably an indication that I used some incorrect terms. If I now put in primary idiopathic adhesive capsulitis and I switch that kind of side part to or and put in frozen shoulder, then I get a big jump to over 3,000. Okay, that's going to be too much. That's too overwhelming. So that's going to include things that are related to both medical management and physiology and physical therapy. So what if I put frozen shoulder and physical therapy? So physical therapy being kind of the general term for treatment, down to 606. So now, here are examples of how I could search for different things by making different keyword combinations. Use frozen shoulder in physical therapy and look at randomized controlled trials, 13. Frozen shoulder in manual therapy in randomized controlled trials, 7. Frozen shoulder exercise in randomized controlled trials, 12. So you can see how using different keyword combinations help to narrow your search and help things become much more manageable. So here again, looking at different keyword combinations, I took randomized controlled trial out of there and it gave me more results because that may be important. It may be that even though we would prefer to find a randomized controlled trial, maybe a quasi-experimental could be valuable too. Or maybe a pre-test, post-test experimental design without a control group would be important too. So if I put in the frozen shoulder and randomized controlled trial or quasi-experimental, gets overwhelming. So you can see you can spend a lot of time, and that's why it's great to construct a table to work on this. So your homework is going to be this, and after I talk about this, I'm going to drop out of the slide and I'm going to go to our library because I want to show you the differences in searching something medical in nature using PubMed and using our university library. So again, in the week 3 module, you're going to see the Word document that I set up there. You're going to have a keyword column, an identified articles column, and a potentially relevant articles column. Note, there isn't an in-critical appraisal because at this time I'm not asking you to review the research for this assignment. Now, You can select, do you want to make 200 be your cutoff? Do you want to make 300 be your cutoff? Or maybe your topic, again, is very new, so maybe 100 should be your cutoff. So if you don't search through a particular set of articles based upon a keyword, just draw a line through that, and that'll be the indication to me that that was too many for you to go through. So submit this to my GFU email address as a Word document, please. All right, let's pull out of this here. And now, here I'm in the GFU library. Go down to Send All with Full Text. Come up to Choose Databases. And I want to go down to Medline. And head on back up. Now, if I wanted just to do a basic search, I can do that very easily. Whoops. Let me clear this here. And what you can see is there's a lot of different things we can play around with. How about if I just go in here and go Mediterranean diet? I always spell it wrong, so thank goodness it's there to correct it for me. And if I just typed in Mediterranean diet, whoa, 15,000. Okay, too much, right? Mediterranean diet and cardiovascular disease. Still too much. How about Mediterranean diet, cardiovascular disease, and randomized controlled trial? Okay, now we're getting lower. So now we need to figure out, we want to look at something like blood pressure. Okay, now we're getting better here. So if you were interested in seeing how your patients with cardiovascular disease, how their blood pressure might change using a Mediterranean diet, here's your opportunity to search through 103 different articles. Make sense? All right, let me clear out of this here. Give me a second. I'm going to just pause the recording. Okay, I went back to basic search again. Now, let's take a look at frozen shoulder. So, frozen shoulder and manipulation under anesthesia. 169 articles. So, if you were interested in working within an orthopedic environment, frozen shoulder may be something that the physician may treat in that capacity. I think they're doing it less and less, but what we can take a look at is if there's anything that compared outcomes. So now what you might have a chance to look at here, okay, so manipulation and anesthesia versus intra-articular steroid injection. So you're starting to see kind of how you can search through things. I'm curious, if I go back to basic search, if I go frozen shoulder and how about exercise and manual therapy and randomized controlled trial, if that leads to any studies that show a comparison between the two. Okay, so here's those 14 potential things again. So I would need to go through those to see what comes up. Let's go into an advanced search and let me clear this out of here. So let's say you've got a patient that you want to advise that individual to do the Mediterranean diet, but they're more interested in what their YouTube scientist has taught them about the carnivore diet. And so you want to be able to come at them with some statistics or some information that shows how the carnivore diet may not be as healthy for them. Well, you could go Mediterranean diet and carnivore diet. And let's see if anything comes up here. Okay, so not a lot that way. So I wonder, we'll come back to that. How about a comparison of the Mediterranean diet versus the DASH diet? 818. Okay, so we're in advanced search now. If I click on that, let's take a look at, maybe we want to change our time frame. So let's go with the year 2000, and we'll end in December of 2023. Okay. So these are potential things you could do. I don't think you need to do it. Let's take a look about randomized controlled trials there. So I don't even have to type it in. And let's see, is there anything else I want to maybe click on? Okay, I think that might be good. Let's see what happens now. Remember, it was around 818. Now, narrowed things down to 428. First one here talks about blood pressure. Well, how about if we take a look at cholesterol levels? Let's see if anything comes up along those lines. Okay, there we go. If that was my interest, looking at the Mediterranean diet and comparing it versus the DASH diet, I could now look to see if there was any research that looked at blood lipid profiles. And so I could go through this and look, okay, there's another one, lipid profiles. I could go through these, and I only have 49 that I have to go through. So hopefully, as you kind of see these different ways, these strategies that you can do things, it's helpful. And if you're having troubles, if you're having questions, I'd love to Zoom with you, talk with you over the phone, whatever the case may be. Let's take one final look here at PubMed. So sometimes PubMed, the search is a little bit different. So Mediterranean diet, hopefully it'll pop up here because I always spell it wrong. Mediterranean diet and carnivore. Whoops. Mediterranean diet and carnivore diet. See if anything, because remember when we did that previously, only one thing came up. 45 results. So now there's more things potentially to look at. They may not be appropriate for your purposes, but it's worth exploring. And finally, let's say you've chosen a topic and you're just struggling. You're just struggling to get articles and you're just like, I'm not sure what the keywords are. This is where sometimes Google can be your best friend. And it can serve as a starting point to help you find articles and then keyword combinations. So now let's go with that same search, Mediterranean diet and carnivore diet, and two other things, research and PubMed. Okay, so first article, benefits and harms of the Mediterranean diet compared to other diets. Interesting, okay. And then now the Mediterranean diet and update of clinical trials. Okay, that might be potentially interesting to see if there's anything that was comparison in there. Going through the abstract, I don't see carnivore jumping right out at me. Let's go down. Okay, Mediterranean diet, nothing that says Mediterranean and carnivore. Oh, here's something interesting. Western and carnivorous dietary patterns are associated with greater likelihood of IBD development. Okay, so maybe there will be situations where you can't find an exact side-by-side look at things, a randomized controlled trial, seeing the outcomes. But there could be things like this where now you start to get things popping up that shows that one particular diet is not ideal. All right. Well, I hope that's helpful. I'm just kind of curious. All right. I won't waste your time that way. I hope that's helpful. Good luck this week as we go through things. Please reach out via email if you have questions, and I look forward to seeing your tables that you create for this week's homework. Until then, have a great week.